Millions of Americans live with a mental health condition. Mental illness affects all of us, whether directly or indirectly through family, friends, or even coworkers. But across the country, we're facing a critical shortage of mental health professionals. Now, take a look at this map from the Rural Health Information Hub that highlights the shortage in our area. You can see it looks pretty widespread. Every county except Clay County is facing a shortage. Now, to fill the shortage statewide, Florida needs about 382 more mental health practitioners. So Dr. Christine Cauffield joins us to help unpack this topic. So good morning. Thank you so much for being here.
My pleasure.
So what do you think, why do you think there's a shortage, first of all?
You know, we have a real shortage. It's a crisis. Actually, it's a national crisis. And we have a lot of behavioral health clinicians, particularly the licensed clinicians, that are finding other opportunities. They're leaving the public sector, if you will, the nonprofits sector, and moving on to the for-profit entities. A lot of them are doing telehealth from home. And so we're really facing a shortage, and it's really affecting our areas.
And what is being done to kind of help combat this shortage?
Well, at LSF Health Systems, we serve the underinsured or uninsured in 23 counties. And so what we've done for the past 5 years is train certified recovery peer specialists, those individuals with lived experience that are recovering from their mental health challenges or their addictions, and they're reaching out and helping others. And we're finding that they're the linchpin for really spreading out those opportunities in the treatment milieu that is really having a shortage of licensed clinicians.
Wow, that is amazing. So tell me, what does training look like to get involved in this type of work?
Well, we've set up at LSF Health Systems an apprenticeship program with 3 of our provider organizations. So these individuals with lived experience, our certified recovery peer specialists, can really do a deep dive and learn more clinical skills, more outreach skills. And in these settings, they have 1,000 additional hours. And so they're very sought after in the nonprofit sector.
So let's say someone at home wants to get involved in this. What type of qualifications are you looking for?
We need individuals with lived experience, either themselves that have struggled with a mental health or substance use challenge, or if you're a family member that has lived in a situation with loved ones that are struggling, you can qualify. Come on in and join our training program. You have to have 2 years of recovery if you do have the lived experience personally, and if not, just a family member, a close friend that wants to really outreach and help others struggling with mental health and substance use disorders.
Right, and we know over the past years we've been hearing so much more about mental health, especially mental health awareness. Why do you think mental health has really been at the forefront these past couple of years?
Well, I can tell you that if there's a silver lining with the pandemic, the COVID pandemic, it is that it's really raised awareness of the importance of having access and qualified team members being able to help individuals that are now suffering from anxiety, depression, PTSD, and other disorders that have really come to the forefront. We have individuals coming into LSF Health Systems that have never come in before, never struggled with a mental health or substance use disorder in the past. And now, with the pressures of the pandemic, now the hurricane, and the aftermath of that, people are really, really needing help, needing access to good quality care.
Yeah, it's definitely not easy. And I know, like you mentioned, there are some people who want to get involved and are using the apprenticeship program. Tell me, how important is it for those helpers to take care of themselves and their own mental health while they help others?
That's a great question, and it's extremely important that our certified recovery peer specialists have support, have ongoing peer support, clinical supervision, so that if they're on the work site, they get triggered from some kind of traumatic event, they have somebody to call and they have a group to count on. And we offer that at LSF Health Systems. We mentor our peers. We're there for them after they get their certification, just for that very reason.
Well, thank you so much. Well, we are out of time right now, but it was a pleasure having you on, Dr. Cauffield.
Pleasure.
Anyone who wants to help out will have more information on news4jax.com.